Public trust in our health systems and our scientists is of utmost importance in terms of the government's ability to help keep people safe. Yet the man Trump has selected to lead HHS is one who has championed and undermined trust in science and medical expertise. The Washington Post dove into 10 of the specific conspiracy theories and false claims RFK Jr. has pushed. I'll read you just a few of them. He has falsely claimed vaccines are linked to autism. He promotes raw milk, stem cells, and other controversial or debunked medical treatments. He incorrectly suggests AIDS may not be caused by HIV, and he has falsely linked antidepressants to mass shootings. So again, to reiterate, this is the man who could soon be running our nation's health agencies. That means he will be making decisions about whether or not to approve drugs or medical devices and vaccines. He will make decisions about regulating hospitals, physicians, and other healthcare providers. And he will steer many other initiatives affecting food and medicine. The day after the election, this is what Kennedy told our colleague Von Hilliard.
You have been a crusader on questioning vaccines. Are there specific vaccines that you would seek to take off the market?
Oh, I'm not going to take away anybody's vaccines. I've never been anti-vaccine.
You will not take any vaccine that is currently on the market.
I'm not. If vaccines are working for somebody, I'm not going to take them away.
We don't know exactly what Secretary Kennedy will do, but we can look to history as a guide. In 2019, RFK Jr. visited the island of Samoa, where he spread his suspicions about vaccines, a feeling he said the prime minister there shared with him. The island at the time was suffering from a measles outbreak after it had stopped vaccinations following the death of 2 infants the year before. It was later discovered that the infants died due to doctors mixing up their vaccines, not because the measles vaccine had harmed them. But during the time in Samoa when they paused all vaccinations, 83 people died. Many of them were children. Meanwhile, the World Health Organization just announced that last year, cases of measles worldwide rose 20% from the prior year due to inadequate immunization coverage. That is where we start the hour with some of our favorite experts and friends. Former White House COVID-19 response coordinator under President Biden and the dean at Brown University School of Public Health, our old friend, Dr. Ashish Jha, is here. Also joining us, former Republican Congressman, MSNBC political analyst David Jolly's here, plus U.S. special correspondent for BBC Studios, MSNBC contributor Katty Kay is here. And here at the table, Democratic strategist and professor at Columbia University, MSNBC political analyst Basil Smykel's here. Dr. Jha, I start with you. Your reaction to RFK Jr. to HHS.
First of all, Nicole, thanks for having me back. This is an extraordinarily bad choice. Let me explain why. As you laid out, this is not just about vaccines. This is about Medicare and what is Medicare going to cover and what kind of health insurance are all Americans going to have, because HHS has profound effects on those. And what we know is that when we have used evidence and science and rigorous analysis to make those decisions, Americans are better off. Robert Kennedy has been peddling in conspiracy theories that are antithetical to good evidence and science. And if he brings that to bear to a whole host of policy decisions, it will affect the health of every American alive. And that obviously is a very, very concerning scenario.
Let me show you, I mean, the thing with vaccines isn't just do they exist. What he said to Vaughn there is I won't take them from anyone. Vaccines and a vaccine schedule works because you trust the doctor who prescribes them. And when your child's very young, there are a lot of them. And so even thinking, well, I don't know if I need all of them, and under-vaccinating a child or someone elderly or senior is also a risk. Let me play his own sort of muddled messaging on vaccines when pressed by CNN's Casey Heim.
Over the summer in an interview, you said, quote, "There's no vaccine that is, safe and effective." Do you still believe that?
I never said that.
So stop me. We have the clip. Please play the clip.
You've talked about that the media slanders you by calling you an anti-vaxxer. And you've said that you're not anti-vaccine, you're pro-safe vaccine. Difficult question. Can you name any vaccines that you think are good?
I think some of the live virus vaccines are probably averting more problems than they're causing. There's no vaccine that is, safe and effective. What I'm saying is that none of the 72 vaccines has ever been tested in a safety study pre-licensing.
Again, if you're rooting for him to make sense, no sense is made. I mean, but what I grasped was that he said, what I was saying is that none of the 72 vaccines have ever been tested. I mean, what is the concern about what people will now do about doctor-recommended vaccines?
Well, first of all, let's be very clear. Every vaccine that has been authorized or approved by the FDA has gone through rigorous testing. It has to. That's how the FDA works. And by the way, you don't have to take my word for it. You can go to the FDA website because it's done in a transparent process. You can look up the data. There are literally hundreds of thousands of people who've been in clinical trials. And when he just says things like that, unless people are going to go and look at the FDA, they start wondering, is it really going to be an issue? It undermines people's confidence in vaccines. And we know, as we saw in Samoa, the effects of that, which is kids will be under-vaccinated. We used to have a period of time where kids used to die in extraordinary numbers from measles and polio. That doesn't happen anymore. And I have no interest in going back to that time period.
Dr. Jha, there's also sort of the practical implications of burning it all down, which is sort of the way people are talking about a lot of these picks. Let me again show you RFK in his own words about getting rid of departments.
Clearing out the corruption in your terms, would that mean clearing out the top level federal service workers that are currently at the FDA and the CDC?
In some categories, I would say.
What does that look like? Yeah.
In some categories of workers, there are entire departments, like the nutrition departments at FDA, that have to go.
What does that mean for the public?
Yeah, so the FDA has a really important role to play in ensuring food safety. We've seen what happens when you make food safety lax. You get outbreaks of E. coli and listeria and all sorts of diseases. It's very, very important that we have food safety regulations. Look, if he wants to strengthen them, great. Let's talk about that. He's talked about a revolving door. The Biden administration put in very tough rules. As a former Biden administration official, I can't lobby the government on a whole host of issues. That's appropriate. If he wants to make those stronger, great. Getting rid of entire departments focused on the safety of the food of our country, I don't know how that makes America healthier by doing that. So, he says things that sound good on a bumper sticker. When you dig a little deeper, you realize a lot of his policy ideas are actually pretty catastrophic.
David Jolly, the interesting thing about the Kennedy-Trump alliance is that Kennedy was up for grabs, right? He calls the Harris campaign and the Trump campaign the same week that he folds up his tent. And Trump basically picks up. So it's not about an affinity. I mean, maybe at this point it is. I've heard he's become a regular, and his wife, the actress Cheryl Hines, is down at Mar-a-Lago too. I mean, maybe it has become that. But in the end, this was a political partnership. And I wonder, do you think Trump knows that he's pro-choice? Do you think he cares? I mean, where do you think Trumpism and the very public, Vaughn used the word crusade RFK Jr. has been on against vaccines, where do those two things meet up?
Yeah, interesting on the political question. I believe Mike Pence has come out now against the Kennedy nomination because of the issue of reproductive freedom and abortion, because Kennedy is pro-choice. So we'll see if there are rumblings among Trump's base. I think he showed this cycle he's willing to ignore the pro-life movement, so I don't think that matters too much. I think, though, history, I know you were talking with Heilman in the past, in the last segment on this, history is a little bit of the present and the future on this one, because it was just several years ago when we saw what the Republican Party and voices in that party did to Anthony Fauci during the pandemic, at a time when you would have thought that we would have suspended this notion of alternative facts and we would have relied on science and leading scientists around the world. The Republican Party decided to just demolish expertise in this space. And I think that's really disconcerting, because when you hear Kennedy opine about vaccines, and when Donald Trump says Kennedy has these ideas and these things, well, the ideas and the things used to be science, but now it's just these these opinions of lay people like Joe Rogan and Kennedy and Donald Trump. And what we saw with the experiment in Florida, where DeSantis and his Surgeon General just decided to ignore COVID and pretend it didn't exist, and 80,000 people died of it. So I think the concern here is most people will not get their news from their physician, either because of lack of access to one or simply that's not the universe with which they get their information. They are more likely to get their information, certainly if you're on the right, from Donald Trump, the people around him, the people he's chosen to put in leadership, like Kennedy, and ultimately that undermines our public health. In many ways, what is so unsettling about this is even without a worldwide pandemic, it feels like we're about to repeat the pandemic we just suffered and the irresponsible voices from the Trump world.
You know, Katty, we've talked so much about what the Pentagon pick and the Tulsi Gabbard pick, what signals those send around the world. But one of the basic measures of any visiting head of state is about the population and how does the population take care of itself, and what are, you know, the idea of putting someone known the world over because of his famous name, but also because of his causes, which are anti-vax and to be a real skeptic of science. What is the view from around the world of this selection?
I mean, it's been interesting. Obviously, the Kennedy name is known everywhere. And so I think there's an assumption that Bobby Kennedy is kind of more like his father and like his uncle. And then when people dig deeper, they immediately get to the anti-vax stuff. I mean, in some ways, what Bobby Kennedy has been talking about, healthier eating, healthier, more exercise for Americans. I think a lot of people around the world might look at America and think, yeah, the country needs some of that. A lot of Democrats have been championing some of those causes as well. But when he compares vaccines to the Holocaust, which he has done in the past, or says that the COVID vaccine, which so many people around the world have taken and have relied upon to save their lives, is the most dangerous vaccine ever produced, then that has, you know, that's alarming. I mean, health travels, right? Americans are unhealthy. They don't get the measles vaccine. They go on vacation, or, you know, to Mexico, or they go on vacation to Europe. They risk taking those problems with them as well. So I think there's a global interest in America being more healthy. And there were moments in the first few days of Donald Trump announcing his picks for his cabinet where I think there was Marco Rubio, Waltz, where people thought, okay, so far so good. This looks like American business as normal. And then you get into, I think, what is broadly seen as kind of more crazy land by many people watching America, and Bobby Kennedy falls into that bracket.
Basil.
Well, that first point is really important because we talk a lot about permission structures. The door that they're going to use to get to where they want to be is by saying, we're going to take on big pharma, we're going to take on big food. That's the sort of door. Mm-hmm. Once that door gets opened, then there's that permission structure to kind of believe and support anything that comes after that. But as everybody has said, when you dig deeper, just consider the fact that in Project 2025, they've erased anything in any agency having to do with equity. So if you now are talking about any serious health issue or even another pandemic, what that suggests to me is that there is no intentionality on the part of the federal government, including HHS and Kennedy, to actually go and address communities that are going to be most disadvantaged or vulnerable on any range of health care issues. And if you remember during the pandemic,